Hello, this is Dr. Stanley Lang hiding behind this card that talks about how exercise heals the brain. And that is the subject of this video today. And the reason I like to talk about this is because I love exercise as the model of whole person or holistic health, where health of body, mind, and spirit are integrated into one uh, way of living life rather than trying to live your life only in the physical realm and not recognizing that there's a big connection between the physical, the emotional, and the spiritual. So recently, I saw a patient who has been a new patient to our practice who wanted to stop taking two very potent drugs that are used to help control stress and anxiety. And it was pretty early on in the discussion, this patient said that she really wanted to make a big difference, but exercise was not an option because she was too tired by the end of the day to do any exercise. So we had a pretty long discussion about the role of exercise in terms of reducing chronic stress. And how chronic stress is reduced by exercise is very, very complicated. But a couple points I would like to make, which I made for this patient, is that one of the reasons that chronic stress is causing so much disease among us now is because more and more people are trapped in chronic stress all day long. They don't get a vacation from it at all. And one of the things that exercise does, from a very superficial perspective, is that it actually creates a vacation from the chronic stress. Very few people, when they are into an exercise program, feel the stress that they're feeling when they're away from that exercise and they're back in their work or they're back in whatever is stressing them out. And literally, an exercise program every day creates a vacation from the chronic stress. And when the mind gets that vacation from the stress, it's like being able to regenerate, and there's a freshness to the rest of the day once you go back into the fray, so to speak. So vacation is the vacation from stress is really crucial for a person dealing with chronic stress. And exercise is one of the most powerful ways to do that. Now, exercise also causes the release of all sorts of chemical changes, both in the body, throughout the body, and in the brain, in addition to the emotional changes that we have. So one of the things that exercise does is causes this neurotransmitter rebalance in the brain, which pushes the body back to more normal balance that it's supposed to be. So you see, when we're under chronic stress, we have a superabundance of a couple of hormones that really aren't supposed to be there in such large amounts, and they affect our body negatively, and they affect our brain negatively. But when we do regular exercise, it helps to push that needle back into more balance for this chronic stress experience that we are having, and we're in more balance and less set off by small things that trigger us, make us anxious, make us angry, as is typical of most people that are having more than enough stress in their life. So I encourage this patient to rethink her strategy about trying to get to a place where she didn't need medication for her stress symptoms and yet didn't want to do exercise. In fact, I told her it was impossible. There was no way she was going to get to a place that she was free of the medicine and controlling her stress without exercise. It is, in my experience, literally impossible. I saw another patient today who has some major physical reasons that he needs to be starting an exercise program, and he works in a construction job, and he just basically said the same thing. I'm too tired at the end of the day to do any exercise. And we talked about that, and he's really not doing anything that even resembles aerobic activity at work. He's simply busy all day long, and he's on his feet. And the thing that his body needs the most is this tremendous relief from the chronic stress of the day that exercise provides. In addition, in his case, there is really good research from decades ago that shows that men who exercise just with a vigorous walk 5 days a week have about a 40% reduction in heart attack rates. Well, that's a life-saving measure, if anything is. And if we had a pill that did that, probably the government would be force-feeding us this pill. or if we had an immunization that reduced heart attack rates that much, everybody would be forced immunized. But all we have to do is start an exercise program to experience that benefit. So in summary, the exercise does help heal our brain because it affects how we experience chronic stress. And it does actually change the balance of significant neurotransmitters in the brain. It's not just so-called in our head. There are actually changes that are happening in a biochemical, measurable way. And so I encourage you, if you're not doing exercise on an almost daily basis for the purpose of stress reduction, I encourage you to start doing that. Now, if you're doing vigorous aerobic exercise 3 or 4 days a week, you don't need to do that 7 days a week, but on the off days, take a nice slow walk to help to decrease your stress. So I wish you well with this. God bless and have a good day.